Milestones matter. Many decades of research have taught us that early childhood intervention leads to better outcomes, and it's a high-yield investment. However, high-quality early intervention, it really needs to focus on the individual needs of each child and each family. And to optimize early intervention, it's critically important that we improve the early detection of children who have developmental and behavioral concerns in the first 5 years of life. So, we need to do a good job of measuring and monitoring, number one, communication skills, how children understand language and how they express themselves using words and gestures. Number two, cognitive skills, how children figure out little problems. Number three, motor skills, how children move around using their big muscles and how they use the small muscles in their hands and fingers or fine motor skills. And, very importantly, personal, social, and emotional skills, how children self-manage, interact with other people, and regulate their feelings, like I'm doing right now. My name's Kevin Marks. I'm an American-trained pediatrician. I worked for many years in the beautiful state of Oregon. Nowadays, I'm very happy to be working as a doctor at a wonderful pediatric department here in Denmark. And, there's one truth I've noticed on both sides of the Atlantic Ocean, and that is that parents really love talking about children's milestones. They really love it. And I just want to let you know that most milestones, they emerge and then they become mastered at around the same age, and this generally occurs in a predictable order, but sometimes they do fall behind. So I'd like to share with you a story about a boy named Alexander. Firstborn child. After his birth, his mom's heart is bursting with joy because he cracks open his eyes and he somehow signals to his mom that he wants to breastfeed. Small but really magical moment. At 4 months, a nurse does a 10-minute hands-on test and she makes clinical judgments about his eye contact and social relationship skills, and then she says to the mom, "I think Alexander is doing just fine." At 6 months, similar procedure, still doing fine. At 12 months, Alexander is now taking his first steps without any support. And he's picking up a raisin with his thumb and his index finger. He is drinking from a sippy cup. He will look for a toy when the mother hides it underneath the blanket. And he says the word dede. But there's not any other words, not yet. At the 12-month well visit with the family doctor, not too much was discussed about milestones. Instead, the focus of the visit was on vaccinations, which I need to say are very important. At 18 months, Alexander is now running, he throws a ball, he says 5 words. 2 of those 5 words is mama and dada, and one of the other 5 words is Bob, which may or may not refer to the family dog, nobody's really sure. At 18 months, he can't yet stack 3 blocks on top of each other to build a tower. Instead of playing with blocks, he spends more time watching videos and cartoons on an iPad or his mom's phone, okay? And when he's having some pretty bad temper tantrums, and when the mom takes away that phone, they really get worse. The mom thinks about his development and then compares it to the neighbor's 18-month-old toddler and says to herself, maybe his vision and hearing need to be checked. So she makes an appointment with the family doctor who does a history and a physical exam, and then the family doctor says this to her. Temper tantrums are famously normal for toddlers. I think that his vision and hearing and motor skills, they seem fine to me. About his language, he's a boy. Let's wait and see him again when he's 24 months old. And then the family misses both the 2 and the 3-year well child visits. Now, it's not entirely the doctor's fault, and it's not entirely the family's fault. We are not here to cast blame. But between 3 to 5 years of age, Alexander's early childhood educators start growing more concerned. Because at 3 years, at this point you can understand most of what he's saying, but there is a fine motor concern because at 3 years, Alexander cannot draw a circle. It just looks like scribbles. There's also a social emotional concern because he cannot sit still during book reading time in comparison to the other children. And at 4 years, he holds a crayon, but in his fist. He doesn't hold the crayon with the thumb, index, and middle finger. When he's playing on the playground and another child gets hurt, he shows empathy. But he is struggling to wait for his turn in line. And when another child takes his truck, he can have a temper tantrum that'll linger on up to 15 minutes. These behavior concerns were acknowledged by the family doctor at the 4 and the 5-year well-child visits. However, there was no parent-centered developmental or social emotional screening questionnaire that was completed at either of those visits, nor was there one done at the preschool or the kindergarten. Okay, at 6 years, a first-grade teacher comes up to Alexander's mom and says, "We have some behavioral concerns about your son, and we have academic concerns." Whew, for the mom. And after a parent-teacher meeting, he's referred to a mental health assessment, and then the family doctor is asked to make a referral to a child psychiatrist. The problem is there's a really, really long waiting list. And meanwhile, the mom is getting visibly frustrated. At 7 years, Alexander is diagnosed with ADHD. And when the mom hears this, she cries. She cries a lot. Not because he had a diagnosis of ADHD. She cried because she had all this stress and frustration that had been building up since he was a toddler. She had spent many sleepless nights worrying about him and crying, thinking that it was her fault, that she wasn't a good enough mom. Then what happens is that after the diagnosis, though, there is a good part to the story, because after the diagnosis, she feels like, okay, now I'm going to get some individualized support. I'm going to have a plan. Now, I think that Alexander's story highlights a need to be more proactive. On the other side of the Atlantic Ocean, the American Academy of Pediatrics recommends a broadband developmental screening tool routinely at 9 months, 18 months, and 24 to 30 months, and as needed, with special attention given to 4 years. And they recommend using a good screening tool. An example could be the Ages and Stages questionnaire. At a federally funded preschool program in the United States that's called Head Start, a parent-centered developmental and social emotional screening questionnaire is routinely done within 1 month after enrollment in the program. Back to Alexander. If Alexander's parents were asked to fill out this developmental screening tool at, let's say, 1 to 2 years, it would have shown that he was falling behind in language, fine motor, and social emotional milestones. Milestones matter. An opportunity was missed in the critical 0 to 3 year period. In the first 3 years of life, there's a lot of interactions going on between a child's genetics, neurons that are being connected but also pruned, stress hormones, and the environment surrounding the child. Alexander and his family needed more intensive and individualized support at an earlier age, but no action was really taken because the best questions weren't asked at the right time. Even the best questionnaires do not make a diagnosis. And ideally, they're supposed to be used in combination with a good history and a good physical exam. But the good ones will accurately identify those who probably do and probably do not have a developmental condition. The good ones should take parents 15 minutes or less to complete. They should be really easy to read, and they should be available in multiple languages, not just one. Also, they should have clear response items like yes, sometimes, or not yet. Yes, no, milestone checklists without cutoff scores based on good science don't work so well. I would really just like to share with you one study. So many studies, but this one I want to share with you. Our study involved comparing 20 pediatricians' ad hoc developmental impressions with the results of the Ages and Stages questionnaire, which was completed by over 1,400 parents routinely at 12 and 24 months, 3 different clinics over a 1-year period. In a nutshell, our study supported the routine use of a parent-completed developmental screening tool because, number one, doctors have human biases. Sorry, but they do. Let me give you an example. The pediatricians who were blinded to the screening questionnaire results, they assessed 12-month-old children, and they made 0 referrals over a 1-year period when that child was from a Hispanic or predominantly Spanish-speaking family. That was not the case with the Ages and Stages questionnaire, which appropriately suggested further evaluation for a reasonable percentage of these kids. Number 2, doctors who are really busy inadvertently forget to reliably ask carefully worded questions in each and every developmental domain. They have a tendency to overlook lots of kids who have milder delays, and especially delays in the fine motor, problem solving, and very importantly, personal social domains. Number 3, doctors either wait and see or they miss children with suspected delays at younger ages. The implementation of the Ages and Stages questionnaire at 12 and 24 months routinely led to a dramatic increase in early referrals to early intervention. We measured in our study a 5-fold increase in referrals at 12 months and a 2-fold increase in referrals at 24 months. And in a follow-up study that I did, we measured that there were higher rates of children receiving early intervention services. However, quality improvement was needed with the whole referral process. So, you're probably now thinking, okay, but what can I do and what can my community here do right now to be more proactive? I recommend, and I want you to remember this, the 4 T's. Number 1, talk, 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 read, 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 and sing to your child. Number 2, take turns talking to your child. Serve and return baby. What I mean is play tennis with your conversations. Number 3, parents are going to love this, turn off your phone and your child's screen, especially in the 0 to 3 year period. And number 4, tune in to what your child is doing and saying. Play with them, be totally present. Now, I want to let you know that most of the time, children will be on track with their milestones, so don't freak out. But sometimes, even if you do the 4 T's, your child's doctor might indicate that an early referral would be a good idea. If you find yourself in this position, please don't wait and see. Instead, just play it safe and get connected to the experts in your community who can help to evaluate your child and your family's unique needs and create a tailored plan. Children who are involved in family-centered early intervention have better developmental trajectories. Children enrolled in early childhood developmental programs are more likely to graduate from high school and be employed as an adult. They are less likely to have serious behavior problems, commit crimes, smoke tobacco, and get involved with substance abuse. And the data says that this is especially the case with children who come from more disadvantaged backgrounds. So, every country, every community should have a good, high-quality early intervention system. My call to action is to do a great job of implementing parent-centered, developmental, and social-emotional screening questionnaires, most especially in the 1st, 2nd, and 3rd years of life, because they help parents to better notice and celebrate their children's milestones. They help parents to learn the signs. And when significant concerns arise, act early. Waiting and seeing is for sunsets. It's not for children with developmental and behavioral problems.